Our next speaker is Nino Butskhrikdze from Georgia. You're very welcome, Nino.
Thank you. So, I'm Nino Butskhrikdze. I'm from country of Georgia. It's far from here. It's a small country located on the Black Sea. The presentation which I perform today on this forum is about how we create and how we reorganize the old admission department into emergency department at our hospital. A little bit about the background, because it's important to understand why we decided to run this project, a particular project at our hospital. Georgia got independence in 1991. It was one of the former Soviet republics, and after the Soviet Union was collapsed, the healthcare system in our country deteriorated. And for that time, all Georgian hospitals functioned as it was under the Soviet system. And what does it mean? It means that there was a huge number of beds in hospital and excess number of physicians. This is the greatest problem. It was the greatest problem for hospital. Another one was that the admission department did not work appropriately, and it means that we admit most of patients on the floor without any initial workups, and physicians who were on a shift in admission department, all times we are requested to call consultants for managing the patient. And it was a great problem, of course. This is why we started this project at our hospital. Now a little bit about the quality assurance experience in our hospital and generally in our country. Of course, my colleagues in my country, they try to do their job better. They try to do the things better and better, but it was not a well-organized process, especially in our hospital. And how to deal with the quality assurance and especially the quality improvement project, it was but unclear for us, and we had to learn how to do this at our hospital. And when we started to run this project, at the same time, step by step, we learned how to deal with the quality assurance project. So I think the key points of our project is one of the key points is the teamwork. Without the teamwork, especially when we have less experience in this field, it was impossible to achieve successfully perform our project, and the right person in the right team, it's of course very crucial for us. It was very crucial for us. So this is the members of our leader team who still is ongoing, is going to keep the work in the department and to maintain what we achieved during these years. This is a well-known model how to run the quality assurance project at the hospital, and I think if we will follow step by step also this model, it makes easier to achieve our goals. And but we learned that the final step of this model, well-known PDCA model, PDCA cycle, sometimes may be skipped if the problem is huge, if the problem is complex, and when we are dealing with the core processes and systems in the hospital. That's why we did not have enough time. That's why we decided to skip in the beginning this cycle and to implement all change it, what we planned simultaneously, and then to see how we will improve and how we will deal with the problems which arise during our work. So, this is the aim statement why we created our project, and the cornerstone of success is to put the clear definition of the goals and what we are trying to achieve during our project. Another key point is to choose the right model of improvement. And I think because large volume customers would be affected by our project, because this should be the ongoing process. The process improvement approach will be the best for our project, will be the best for our project, and so the decision was made, the clear goals were set, and we started the preparation of our project. So I think another key point of success is to use the scientific approach during our work, because it gives opportunity to see what is our opinion and what is the fact. And here is a huge difference. Sometimes we are thinking that we are doing things very well, but not all changes are improvement. So scientific approach gave us opportunity to follow our project step by step, and to see where are we doing well and what was the problem. Another a reason why should we follow the scientific approach is that sometimes the problem what we see, it's on the top of the iceberg, and what is on the bottom, it should be figure out, should be founded, and that's why we decided to use the approach of brainstorming to find the ideas of what is on the bottom of the iceberg, because the database was not enough for us. We didn't have a good database for the time at our hospital, and to collect the objective information, it was very difficult. That's why we started the brainstorming process, and especially in the situation when team members are very familiar to each other, they know each other very well, and the atmosphere inside the team is uninhibited, it works very well. So the next step is how to identify, and when we saw, we got the huge list of the problems, and it was quite difficult to know which problem is the high priority and which is the less high priority. That's why we decided to use the prioritization matrix to see from which problem should we start, and for this we use the tally sheet and of course the Pareto chart to see how problems are prioritized according to our tools. This was one of the steps of our project, and another was to identify what changes we needed to achieve our goals. And first of all, I'd like to say that we decided to divide our project in 3 steps. The first step is to get the improvement from the top management, of course, to write project, and when we calculate the finances for our project, we saw that it was a huge amount of money, and we needed the sponsors. That's why we tried to find persons who will pay for our project. It was very important for us. And the second one, we were dealing with the field of medicine where we have less experience. I mean the emergency medicine. Before, it was not like a specialty in our country, and that's why we tried to find the people who will help us, and it was the Emory University faculty who run training programs at our hospital. I mean the emergency medicine 8-month training program, and they helped to organize the process inside the department. So the first step was finished. This is how we share the responsibility among the members of the leader team. It was very important because if we don't know what to do and how to do it, impossible. It will confuse the situation inside the team. So another step, and the next step was finished in 2007 when the first adult emergency department was opened at our hospital, and this was the changes what we made for preparing of our department, and we implemented all of these changes simultaneously, and finally we opened our department in 2007. So, but we thought that it was not enough, of course, and the department needed to be improved all time, and in the scope of the main project, we started to run the small project, and for this reason we created ad hoc teams, and at the same time we are dealing with the greater problems too, like a creation of guidelines, like a creation of documentation, I mean the improvement of documentation, to put the infection control nurse and a group in the department, and to run the interdisciplinary clinical pathway and coordinate our work with other departments. So it was done by the frontline teams who were dealing with a particular problem and particular changes. So what we got at the end of our project, but it's an ongoing project. I think we'll hope to get more in the future, and I will discuss this a little bit later. What we got? We got the department, which consists of these parts, I mean emergency department. What was the main important thing in the department, that we changed the nurse-physician ratio. Before it was 1:1, and now it's approximately 1:3, except not included the nurse assistants who helps our nurses to manage the patients. And we have a special quality assurance group in the department, and the infection control group at the department. So, what we have before the project and what we got after the project. And I'd like to say a few words about the education in EM, which is very important, I think, because nowadays we are running at our hospital the continuous educational process for our own physicians who are working in emergency department, and at the same time we are running the special subspecialty training program for other hospital physicians, and they nowadays have a possibility to get the certificate as emergency medicine physicians, and it's very important for us. Because our society of emergency physicians is growing and growing, and it's very nice. So, a little bit data from our department. This is the number of patients per year. We can see that in 2011 and 2012 numbers are less, but it's because the main part of our hospital and the old part was closed, and in few months we are going to renovate the old part too at our hospital, and it's the bigger project than this one, of course, and that's why the number of, nowadays we have just 100 beds at our hospital, including the critical care beds, and that's why the number of beds and number of patients are less. So it's the average length of stay in our department, and we can see that that the length of stay is decreased, and especially it's decreased for discharged patients. So our physicians are doing much better job to make decision about the patient, and their knowledge is improved. So it another benefit from our project. This is the ratio of discharged patients. We are discharging more and more patients directly from ED at home, and number of consultations per patient is decreased. It was 0.9, and nowadays it's approximately 0.6, and the percentage of deaths, of course, declined from 1.6 to the 0.8. So it's data before ED and after ED. It's 1 year data of our hospital, and we are proud especially about the percentage and number of deaths. Even the critical care beds at the hospital, number of critical beds are increased. So these are benefits what we got from our project. Now patient can get the qualified care from the beginning. Errors with admissions are minimum, and we can keep the patients at our department for a while, and then discharge them directly with the follow-up. So we have all equipment and all diagnostic means for managing our patients in ED. So benefits of emergency medicine: it saves, of course, financial and human resources, except the patient safety improving, and of course it's quite important for our administration, of course, and it saves the patient's money, of course. So, emergency, I'd like to tell the few words about the future perspectives, and our project is an example how can we start from the smaller project and transform this project as a healthcare system-wide project, and I can say as a nationwide project, because now Ministry of Health and governmental structures are interested very much in our project, in the development of emergency medicine. Is the first new specialty adopted by the medical councils in Soviet Union, and it happened after our project, and we are very proud of this. Yes, and it's a multidisciplinary medical specialty. It's quite important for our regions where we have a lack of specialists, less resources than in the capital, and so. And to manage the small emergency departments and in the regions, it's easier than to deal with the big hospitals. And especially in the high mountain regions, it was quite important for us. So this is the keynotes and what we learned from our project. And I'd like to emphasize the last one, that nothing is impossible, I think, yes, and to start when you don't have enough knowledge in this field, you are not familiar with system which you are going to create anyway, it's possible, I think, if you will manage the project properly. Thank you a lot.
Thank you very much, Nino. Thank you. Time for one question. Any questions? Just one, yeah, just back there. Could you introduce yourself, please, when you're here?
Hi, my name's Charlotte Hopkins. I'm an HIV physician working in London and an improvement advisor. Congratulations.
Thank you.
I won't ever think I've got my life or many challenges at work again listening to your story. I just wondered, because you put at the end, one of the outcomes was it saves patients money. Do patients have to pay for their health care in Georgia, and how much do they now save pre and post change, and what proportion of Georgians' income does their health care cost?
In the beginning of our independence, the insurance was not well developed in our country. We have the few companies, the insurance companies, who were dealing with the insurance of healthcare in the healthcare system. That's why the patients, of course, and the second problem was that income in our country is not so high as it's in the Western countries. That's why patients sometimes cannot pay for insurance. It was impossible for the time, and then they had to pay their own cash if they have a problem with the health. That's why it was impossible to, that's why I put this sentence at the end of that slide. But nowadays situation in our country is significantly changing, because we are creating our like a governmental insurance for the people who cannot pay for the private insurance, and I think the things will go much better soon.
Thank you very much. Thank you.
Thank you.
Ladies and gentlemen, another round of applause, please. Thank you.